Okay, Richard Kirsch, the Director of Healthcare for America Now. You just came back from the Healthcare Summit. Tell me what happened.
Well, President Obama started talking to everyone and said we're going to get health quality, affordable health care for everyone this year, and reaffirmed his commitment to that at some length. And that was just a huge thrill to be sitting there in the East Room of the White House with the President of the United States, knowledgeably, firmly, passionately committed to realizing this, age-long American history. It seems like promise of getting quality, affordable health care for all was fantastic. Then we broke out in sessions.
Mm-hmm.
There were a whole bunch of sessions. I was in one with several senators and members of Congress and people as diverse as Tom Donahue from the Chamber of Commerce, and it was moderated by Treasury Secretary Larry Summers.
Wow. With that diversity, did you get a sense that we could make real progress this year on that, or what about the ideological gulf that you saw there?
Well, the biggest place the ideological gulf showed up was around the question of whether people should have the choice of a public health insurance plan or just get stuck with private insurance. And it wasn't in my session, but afterwards, when the whole group came back together with the president and with Ted Kennedy, and it was very moving when the president walked in with Ted Kennedy and he got a very long, rousing ovation. But the president read quotes from several people, including Congresswoman Jan Schakowsky, where she talked about the need for a public health insurance plan. And the president said, well, some people argue differently. But then Senator Chuck Grassley's one question was to basically say there should not be a public health insurance plan. And this is interesting because the president started by saying everything should be on the table, and right away Grassley took off a public health insurance plan. So that sort of started laying bare some of the ideological things.
Right.
And what the president says, well, people argue for a public health insurance plan because it's as a choice, because it enhances choices and it controls cost. And he said some people make other arguments, but it's clear that, Chuck Grassley is fighting an ideological argument, denying people in Iowa and around the country a choice because he wants to protect the health insurance industry.
Well, do you get a sense, though, coming out of that meeting that there's more momentum for healthcare reform now than there was when Hillary Clinton was running this process?
Well, there's much more investment by people as part of the process in a public way and being brought in the process. And that's a big difference from 93, 94. And in addition to which, and it's interesting again, Tom Donahue from the Chamber of Commerce was in my breakout session, and he said, business is in lots of different places, which mostly wasn't true in 93, 94. They were much more opposed. There were a handful of businesses in the airlines and auto companies that were for, but the business community really did not want to see reform. I think what's encouraging is that the fact that the business community is in different places. In fact, Donahue said some businesses would like to see the government take the whole thing over. So that was pretty interesting. So I think that the fact that the business community understands something's got to be done, and that they're not really sure what, but they're not opposed to a major government role is a difference. And I think there's a sense of urgency that I was in Larry Summers, Treasury Secretary Summers, moderated the session I was in. He said, this is going to get done by December 31st this year. So I think there's a sense of urgency, there's a sense of commitment, and all hands on deck.
Still, we've kind of seen this before, and we know the buzzsaw of special interests that come in on these big issues, and before you know it, everything falls apart. What has to happen, and how much has to happen in order for that piece of history not to be repeated?
Well, people have to really be engaged, Isaiah. People have to, at the grassroots, really, really be engaged. One of the things we did today is Move On took the lead in asking their members to set up one-line petition that says we're not going to let the insurance industry lobbyists stop us from getting health care this year. And in a week, 302,012, I think, was the number of people who signed that petition in a week.
Wow.
Myself and Roger Hickey from the Campaign for America's Future delivered a CD with those petitions to members of Congress who are at the summit today. That's just the beginning of the kind of engagement. People are going to have to be engaged, and they're going to have to really tell their members of Congress that they're not going to let the insurance industry or the drug companies or the small business lobby or the right-wing ideologues stop this. And that's what it's going to take. The president keeps saying it. The president says over and over again, powerful Washington insiders, insurance companies, and drug companies that killed this before, and he doesn't want to let it happen again. We have to help him.
And what is Healthcare for America going to be doing over the next few days and weeks?
Well, I mean, we're basically mobilizing America, as our name says, Healthcare for America Now. So the next huge mobilization is going to be during the April recess. We're building to meeting with members of Congress in about 80 congressional districts. We'll have at least 10,000 people in the week of the congressional recess meeting with members of Congress. People should get involved. The best thing to do is go to healthcareforAmericaNow.org, sign up. You'll get our regular e-alerts. We sent 23,000 faxes to the Senate Finance Committee week before last. So if you sign up, we'll have regular ways to get you engaged, either through the internet or locally in your communities to get the message out to Congress.
Well, it's a pleasure talking to you.
It's good talking to you, Isaiah.
Thank you.
You bet.